Hi, Mr. Jones. My name's Tori, and I'm part of the Respiratory Care Department. I'm here today to obtain an arterial blood gas sample that your doctor's ordered for you. Could you verify your name and birth date for me, please? Thank you. I'm also going to take a quick set of vitals, including your temperature, and I'm going to document the FiO2, if the patient's on room air or on any oxygen, as well as the physical assessment of my patient. Mr. Jones, an ABG sample that I'm going to be obtaining from you today is different than any of the other blood draws that you've had while you've been here at the hospital with us. An ABG draw is different because we're taking the sample directly from an artery, and arteries contain oxygenated blood. So this sample is going to tell us how much oxygen you have in your blood, as well as how much carbon dioxide retention that you may have. The results from this blood draw are going to help us to be able to better help you with your breathing issues once we can understand exactly what's going on. Do you have any questions for me? All right. So I went ahead and got everything set out here. Everything I need. And we're going to make sure that we always wash our hands before we do any type of blood draw, as well as apply gloves. Before we apply gloves, the first thing that we would do would be to palpate the patient's wrist on both sides, the radial artery, to determine which had the stronger pulse. And after we've done that, we'll perform an Allen's test, in which we have our patient hold their hand out palm side up, and we include both the radial and the ulnar arteries and have them open and close their fist 3 times. During which point you'll notice that the hand will begin to become pale. After releasing the ulnar artery, you'll notice a flush of blood should return to the hand in just a few seconds, in which case we know that there's enough blood flow to perform an arterial blood draw. If this was not to happen, we would not have enough blood flow for an arterial blood gas sample. So, to go ahead and begin the blood draw, first we need to position our patient with their palm side up, resting on a material. We want to make sure that they're as comfortable as possible, and we're going to go ahead and apply gloves. After applying gloves, we're going to go ahead and, in a circular motion, we're going to clean the patient in a circular pattern, as well as the fingers that we're going to use to palpate. Alright, so we're going to go ahead and palpate for that radial artery. We want to feel that pulse. Alright, we've got the pulse. So first I'm going to just gently remove the cap of my needle, and it's drawn back to where we need it here, the level of blood that we'll need. It's important to note that the bevel side of the needle needs to be facing up when we do an arterial blood gas draw, and we need to hold the needle as if it was a pencil. So, holding it at a 45-degree angle, like a pencil, with the plunger already set, we're going to go ahead and palpate, and once we find that pulse, we're going to go ahead and insert the needle. If we don't see a flash of blood immediately, we notice that we need to just pull back, but not out through the skin, and relocate. There we have our flush of blood, and we wait until it's filled completely. And then using gauze, we're going to remove the needle while applying pressure onto the place where we've just drawn the blood, and we're going to use a stopper to put the needle into so that no one gets a stick. We're going to hold that pressure for 3 to 5 minutes unless otherwise stated. If we had a patient that, we'll go ahead and seal that sample. If we had a patient that had trouble with blood clotting, it would be longer than 3 to 5 minutes. The next thing that we're going to do is just apply a Band-Aid after our time has finished. So go ahead and apply that Band-Aid. Alright, now that we've sealed our sample here, we need to remove any air that may be in there, so we'll just gently push up just to remove any air bubbles. And we'll roll if this was liquid heparin, we would roll it to mix it with the blood. We've also already filled out our label, so we're going to go ahead and put that around our sample. And then our sample is going to go into this biohazard bag, and this will be sent to the lab. Then we have to deal with our sharps. So all of our sharps will go into a sharps container where they'll be properly disposed of so no one can get a stick. We'll clean up our area and remove gloves. And lastly, we're going to go ahead and wash our hands, making sure that our patient is comfortable, they're having no swelling or excess bleeding, that they have our call light sitting nearby.